Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the third show of Pregnancy to Parenting. I'm Hawa Solomon. Today we talk about fertility, the miracle of conception, and the options if you do have problems with fertility. Joining me today is Dr. Malika van der Schyff, a gynecologist and obstetrician in Constantiaberg and based in Rondebosch Medical Center. Assalamu alaikum to you, Dr. Malika.
Wa alaikum salam wa rahmatullahi wa barakatuh, and thank you so much for the invitation.
Thank you for having us here at your rooms in Rondebosch. Alhamdulillah. Today we look at fertility, a big question and lots of issues and discussions around fertility. What is fertility?
Well, fertility would be the ability with you and your partner to be able to conceive and to be able to obviously fall pregnant and carry a pregnancy to term.
When you look at fertility and wanting to fall pregnant, what would maximize your fertility?
Well, for most women, it would be that you are in good health. It would be diet issues and things that we will continue to discuss in greater detail about multivitamins, diet, whether or not you're ovulating. So it's generally your gynecological health as well as your general health as well, because there are certain diseases that can interact and impair your fertility. And of course, now we're talking about women, but we have to remember it's not just about the female, but it's also about the male contribution as well. So both parties, both future mother and father, need to be as healthy as possible prior to pregnancy.
Okay, because that was going to be my next question. Yes. What is the male's role besides, having a good relationship with the mother, and what happens behind closed doors? What are their roles to have those super swimmers, as they would say?
Yes, absolutely.
Work best?
Yeah. Well, I think if we're looking at general health and we're concentrating on men at the moment and their general health, it would be medical conditions, optimizing and checking that if there is any comorbid medical conditions that is associated in men's health, for example, high blood pressure, diabetes, any other medications that could be on board, so that we would establish when taking the history from the partner or the husband. And what we would also establish is job, recreation, drugs, recreational, smoking, alcohol, things like that we'd have to consider. So, for example, excessive smoking can be associated with decreased motility in sperm. So, yes, if in order for the boys to be swimming really well, I would recommend with a lot of my male patients that decreasing smoking or stopping smoking, ideally, checking which other medications or herbal medications or drugs or alcohol might be in the system, checking that whether or not in their past history was there any trauma, perhaps, that horrible soccer injury or that cricket injury that might have been to the scrotal area that might have caused problems. And also just if there's been any other diseases that can really, really impact your fertility, like previous cancer, undescended testes. So all of those. And then in trying to maximize, after establishing that as a baseline, in trying to maximize sperm and sperm count, a lot has been shown that high-dose multivitamins can help. For example, in men, it's been shown that high doses of folic acid, selenium, choline, inositol, and your antioxidant vitamins like vitamin A, D, E, and C, these are all multivitamins that can actually help to boost fertility and boost sperm production. So there are names, which I won't mention on air, just, where these are combinations. And there are multivitamins which actually have names and words in it that are specifically targeted towards trying to boost sperm count and fertility where that's concerned.
Wow, interesting. I didn't think we'd get to this topic, but it's great to actually start out of it, because it's not very comfortable when, it is always the woman's issue of trying to fall pregnant. So to look at it at both ways and say both the male and the female should have themselves checked. So, and that process, what does it entail?
And, often people think you should only come to your doctor if there's a problem or if you've been struggling. But it actually is really advisable for the couple, and it needs to be the couple with both of them involved in the consultation, to actually discuss your health as the woman, your role, whether you're ovulating or not. The same thing, doing the history, doing the examination, perhaps doing some tests, which we can go into later as well. And what we do in our history, in a good history, when it involves not just your history as my patient, as a gynecologist, but also your partner, their problems, as I said, medical history, previous injuries. Does your job expose you to a lot of chemicals or heat that could perhaps cause problems, multivitamins, smoking, things like that. So it's vital and important to actually see both of them as a whole. And it's amazing, just by pure education, how it can be the perfect, prevention of problems, or to alleviate that stress as well.
Now, what if the question comes about that it's, I don't fit the criteria to go and have ourselves checked as a couple, both male and female, and what suggestion would you give to somebody that has that idea that not having themselves checked out before trying to, fall pregnant?
I think that from a woman's health point of view, we've kind of concentrated on the men at the moment. From the woman's health point of view, it is first and foremost knowing and monitoring your cycle. To actually know that, with your menstrual cycle, keep an eye and monitor it. And I mean, we've spoken before, how I always say this. We are so good at remembering everything, but remembering your cycle is terrible. And the way we have smartphones and smart applications and things these days, you can actually record it. So that, and also to understand what that means, what your menstrual cycle means. What your menstrual cycle means, it is from the first day of your cycle through to the day before your next cycle starts. From the first day of your period, rather, your first day of your menstruation or bleeding is the first day of your cycle, and then ideally a month later or 28 days later would be the day before your next period or bleed starts. So firstly, it's getting the information, knowing that, how to monitor your cycle. So kind of how many days am I actually bleeding? How many days do I have from the one period to the other period, or the one menstruation to the other menstruation? So that's where it works out to firstly saying monitor the cycle. And then within that, that in the middle of that cycle, often on day 14 is when we say ovulation takes place. And not everybody ovulates exactly on day 14. It could either be 1 or 2 days on either side. So I often recommend to patients, if you're looking for the ideal romantic time or the ideal fertile time, I would recommend day 12 to day 16 of your cycle. So 12 days after the beginning of your period until 16 days after the beginning of the period is an ideal time.
Okay,
if you want to...
when you fall pregnant,
when you're attempting
to fall pregnant, at least in your period, you generally have the 7 days. So then 4 or 5 days after that.
It's often good to think of it as, first day of your cycle, count 12 days, and know that would be from then onwards for a few days would be your fertile time. And this often works very well for patients who complain about fertility but have, for example, partners or husbands who work out of town or is work shifts or odd hours, or perhaps for months at a time is out of town. Knowing that kind of timing is vital and important as well.
Another big question here, does age play a role on fertility?
Absolutely. Absolutely. From the female point of view, definitely. Some of my colleagues and friends in the fertility clinics would say, try and complete and finish your family before age 32. And, often we'd say 35 and above would struggle, perhaps. And it's not an exact criteria that at exactly age 36 you're going to struggle. But for all intents and purposes, ideally, teens, 20s, early 30s should not be that, your chances of conception and your chances of carrying that pregnancy to a full-term pregnancy is higher. Once we start going above 35 and definitely above age 40, your chances of problems of conceiving is difficult, problems with the pregnancy is difficult, and, your miscarriage rate, all of those, and abnormalities which might happen linked to age of the woman. So, for example, Down syndrome or some of the other genetic syndromes that can be linked to that. Okay. And where it comes from is that where age plays a role is that we are born with a set absolute reservoir of eggs, of follicles and eggs, which still need to mature for us during each ovulation cycle. And it is in each woman how much of that gets used. So yes, we all know that there are friends or people we know at age 45, 46 that have fallen pregnant, and couples in their 20s that struggle. But if we're going to use loose references, I would recommend saying, listening to some of my fertility colleagues and say age 32, 34, try and complete your family
before then. And in today's circle, most couples are starting families at that age.
Absolutely. And obviously this is not an exact, it's just that when we do speak about infertility or difficulties in trying to fall pregnant and needing to have assistance, which I know we will discuss as we go, is that there is a cutoff for when it is difficult to help with regard to assisted fertility. And that would be in your early 40s. Okay. So I would absolutely recommend that before that, to try and complete your family, given that you're healthy, that it fits into lifestyle, things like that, and Allah willing, inshallah.
We will continue this discussion after the break. Please stay with us. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Pregnancy to Parenting. I'm Hawa Solomon, and in this very interesting discussion with Dr. Malika van der Skeef, gynecologist and obstetrician. She's based out at Constantiaberg and Rondebosch Medical Center, and we are really happy to be at her Rondebosch rooms today. We're looking at fertility and discussed that just before the break. Now we talk about the miracle of conception. Assalamu alaikum and welcome back, Dr. Malika. Now, what all happens to the body? And it was very interesting, the information about fertility, and we're going to move on a little bit later on when it comes to the problems. But what all happens to the woman's body when a successful fertilization occurs?
It is such a beautiful process, mashallah. And it is actually such a miracle. And that sounds like such a cliche when we say that. But, some patients will say when they weren't thinking about it, they fell pregnant very easily. And when they are trying, it's difficult and things. But it is, for all of those things to be happening, you have ovulation that has taken place mid-cycle. So your ovaries has created this little follicle with an egg in there, and it gets released into the tube or the fallopian tube, the tube, and waits there for fertilization to take place. And sperm would then travel through the vaginal canal, the cervix, the uterus, into this tube, and that's why it's so important that your tubes are patent and open and functional. And then they meet up there, and that's where conception or fertilization takes place. And that little conceptus, whilst busy dividing from being just this one cell entity into this future fetus, moves through the tube into the uterus, which has been primed for with kind of baby food, as we say. The lining of the uterus has been primed for implantation. That implantation takes place, and then that is eventually, when it all starts, and you end up having this beautiful life that starts, and those cells which eventually form, and initially is more like a plate and starts forming into almost 3 little sectors, and you have your little heartbeat that can start at 4 to 5 weeks. So at as easy and as close as 4 to 5 weeks, if all things goes correct during the consultation and everything is primed, then you can actually see a heart rate as early as 4 to 5 weeks already.
Okay, now that is going to be a different program when we look at the first trimester. So
Absolutely.
Viewers, please have to stay tuned to that. But what conditions would really, and coming back to infertility, what conditions would interfere with fertility?
Well, the important thing here is that first, the definition of kind of infertility would be if you have been trying, the official textbook definition is you have been trying to fall pregnant off contraception for a year, and you've been actively trying. So some patients would come and say, we're trying to fall pregnant, but my husband's at sea for 9 months at a time. That doesn't quite the definition of actively trying. Yeah. So you've been trying and it's just not, not working. And you have your female factors and your male factors. I've highlighted a little bit about the male factors as well, a lot of which is more linked to environmental issues that can affect sperm, toxins, medications, previous illnesses, comorbid diseases like genes? HIV, things like that. More it would be if it was a major genetic abnormality. And then if we're looking at it from the woman's point of view and issues that can happen there, and we just break it down logically, it can be linked to structurally, as in, if we're just looking at it, could there be something wrong with the mouth of the womb? Could there be something wrong with the uterus, its shape, its size? Could there be something wrong with the tubes, which is often in South Africa a big factor for infertility, is whether there is a tubal factor, as have you had previous infections, previous sexually transmitted infections, or is there possibly something like a disease such as endometriosis, which causes bad inflammation, bad scarring outside of the uterus, and that would actually, as I'd mentioned before, prevent egg and sperm from physically getting to each other. And that's often a big cause as well. And then our other big causes is linked to the ovary and everything associated with trying to get correct ovulation. Are there any functional cysts on the ovary, growths on the ovary? Also, are there any hormonal imbalances? In Cape Town and in South Africa, we've got a large incident of polycystic ovarian syndrome, which is a condition which affects fertility. It involves where your period stays away for months at a time, is associated with infertility, miscarriages, excessively painful periods, irregular cycle. So all of those would be linked to the gynecological system. And then we also need to look at the woman as a whole. Obviously, we do look at age. We also look at any comorbid factors, diabetes, high blood pressure, TB, HIV, all of those things. So it's a long, complicated list. And unfortunately, it doesn't just need to be one. It can be a female factor and a male factor as well. So that's why it is so important to not just concentrate on one party, actually look at the couple as a whole.
Right. Now, socially, everybody talks about contraceptives being a big step in the foot when it comes to trying to fall pregnant.
Yes.
So your history with contraceptives, does it play a role in infertility, trying to fall pregnant?
It can play a role in aiding and impairing as well. So you'll find that there's a big misconception out there of, I've been on contraception for years and I'm struggling to fall pregnant now. Often some patients would go onto a contraceptive, not even necessarily for its contraceptive purposes, but for the purposes of cycle control, conserving blood, and that pregnancy was just not an option at that time, but it was trying to keep your periods low, your period pain less, and trying to keep your bleeding less, so preventing bad anemia, and trying to keep your cycle regular, because it might be convenient not to have a period once a month in a condition like polycystic ovarian syndrome, but it's not healthy, and it's not healthy for future fertility. So in cases like that, that can actually aid your fertility, by having been on a treatment, not even necessarily the treatment as the contraceptive, but being on a hormonal pill or things as a treatment. But then there are, it's not that clear cut or that black and white. There are certain times when, for example, having been on a certain contraceptive can delay your fertility. So, for example, after the injections that women go on, the injection which tends to take your period away in a healthy fashion, but it does take your period away and it suppresses your ovulation. So it suppresses that ability to actually generate that egg each month. And sometimes if that happens, you take a while after stopping it, because sometimes it is in your body longer. So we say sometimes it can take anywhere from 9 weeks to 9 months to work out of your system, as hectic as that sounds, for the injection, for the injectable contraceptives. So there are exceptions to the rules where sometimes it can delay your fertility, but I should also say to people that, you know, a contraceptive should not cause your infertility. It may delay your fertility and it'll take a few months. So often, and patients get very confused when I say this, often what I say is, if you want an oral contraceptive, a combined oral pill, and you're thinking of falling pregnant, and a lot of people time the pregnancy, but when they phrase it, they're not quite sure. It's kind of like, maybe I'd like to be pregnant in a couple of months, maybe not. And they're not sure how to stop that contraceptive pill. My advice usually is stop the contraceptive pill a year before you want to have the baby. So here's where everybody misunderstands me and eyes go wide and they go, but I don't want to wait a whole year. A year before you want to have the baby, because it takes 3-4 months to fall pregnant perhaps, and you've got 9 months of conception, then it's a year. So then you can plan around that. So if you're deciding, I would like a summer 2014 baby, then summer 2013 stop the pill, you know, obviously while starting high dose multivitamins and, you know, doing your health checks. So
start that again with us, those that are contraceptives, because there's the idea when I stop my contraceptive I will fall pregnant. If they don't, there's this red crazy light that goes on.
It was the cause.
So it is stop a few months before you actually
you would intend actually being immediately pregnant.
Even though you're getting
just give yourself give yourself some time for your cycle to regulate, your multivitamins to work, and also just because contrary to popular belief, and alhamdulillah it happens beautifully, but it's difficult to actually conceive even if you don't have problems.
That's why it would take a miracle.
Exactly. It would take a couple of cycles to actually conceive. You know, some women will say they were pregnant the very next cycle after the period, and alhamdulillah, that's fabulous. But that's not often the norm.
And that is where I also want to come in and say, is that genetic? Because sometimes, you know, moms would say, you know, you must watch out. I felt pregnant immediately when I stopped my contraception, and then they warn their daughters.
I think we have to be very respectful of heritage and of genetics and that. It may not be as formally written in the textbooks that if your mom had 5 kids, you're going to have 5 kids. But, you know, often I'd find that trend in the practice, you know, that they'd say, oh, my mom said I didn't struggle to fall pregnant. And that's a great piece of advice, but sometimes it can also make you a little bit anxious. But it is worth it being respectful of that. So some of my patients would say, I am coming off my prevention, my family planning, my contraceptive, but I'm not interested in falling pregnant immediately. I'd like to just see, is my cycle coming back or things like that. If that's the case, then they would need to obviously be cautious.
All right. Now, we have spoken about the partner and your husband and the factors that, you know, would help him also improve fertility. Now, should your partner have a condition rather that interferes with fertility, will these conditions worsen over time, improve, or remain constant? What should we, you know, kind of do about that?
If we're talking from a male factor point of view, sometimes the quality of sperm can change, as I'd mentioned before, linked to going on to high-dose multivitamins. So in certain conditions, there can be an improvement. You know, I think if there is anything really dire and hectic, medical conditions, if you're dealing with your hypertensions as your comorbid factors, you're dealing with your diabetes, you're dealing perhaps with having had surgery or testicular cancer before, obviously those things would worsen over time. Or unfortunately, you're dealing with cancer or, chemotherapy, those things would worsen and its improvement would not be as good, as we go. But if you're dealing with the very low-grade issues like perhaps a poor pattern of sperm, or it doesn't, they're just not swimming as fast, that might actually be able to be fixed.
Okay. Yeah. Now, going through the whole process of trying to find, whether you are infertile or not, and if the reasons of your infertility is maybe unclear, what sort of diagnostic tests are recommended in that case?
This is a very wide question, which we could probably go into an entire show on its own. And there's basics that the patient can help you with. Mm-hmm. So as I said, the basic tests the patients can help you with is, and I'll start with that first, just with that for now, is monitor your cycle. That's the homework you can do for me. There are ovulation kits out there that monitor saliva. There are blood tests that can monitor ovulation. You can monitor your temperature where your cycle is concerned to monitor ovulation. So those are just basic tests before you actually get to me that you can go into, which will give me lots of information as well.
Shukran so much. After the break, we explore the options of infertility. Back in a moment. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. This is Pregnancy to Parenting. I'm Hawa Solomon. Before the break, we were investigating some of the diagnostic tests that could be done if you could possibly be infertile. Assalamu alaikum and welcome back, Dr. Malika. That question of infertility is a scary one.
Absolutely.
For anybody facing or coupled, falling pregnant, wanting to have a baby and start a family. Before the break, we were just starting off the discussion on those tests and what could possibly be the reasons and, what are the procedures that one could follow.
I've mentioned a lot about, keeping your menstrual cycle, giving me an idea of what's going on, taking a good history. Obviously part of your investigation is doing the examination. What can you find out in the rooms? In the rooms, we often would perform your pap smear. We would do the examination, check to see, is there any evidence of infection, any evidence perhaps of any sexually transmitted infections or pelvic inflammation where there would be excessive pain, and there could be a possibility that there is any kind of infection or pus in the tubes, so that we can figure out clinically. Investigations that we would do and is perhaps an ultrasound scan, either abdominally or transvaginally, which can tell us about uterus, its shape, its size, depending on when you are, whether you're ovulating, depending on the timing of the scan, depending on the lining of the uterus. So trying to get to the pathologies that I have spoken to. So you can get towards making that diagnosis in the rooms, and you can get towards suspicion of that diagnosis in the rooms. And the tests you can do can be, far and wide. You can actually do just the basics, or you can do the whole kind of spectrum, and that's quite large. And what we often would do is basics, and also checking, for example, about infections, checking your immune status, so your HIV, hepatitis, syphilis, German measles, to check if you're immune to German measles, because not so much because it'll make you fertile or infertile, but it's often very severe if you're pregnant and you end up having German measles. Okay. And if you have not had it or not been successfully immunized against it, you can have the vaccinations, but you might not be able to fall pregnant immediately after the vaccinations. So that would delay things.
What happens in that case when you're not too sure whether you've had the vaccine or not?
We often do, as I said, a blood test to see, because even if you or your mom can't remember if you had it as a child, the blood test would establish, as I said, whether you've had it or whether you've been successfully immunized against it, whether the injection actually took, or some patients, some parents make the decision not to have the injection. Not that I think that might be the smartest thing, but and then so those are just basics.
We'll talk
investigation
about
that can definitely be part of a different program. And when we go further, we can do different forms of scopes, blood tests to see whether you're ovulating as well. For example, if we suspect there might be something wrong with your uterus, if congenitally you might have a double uterus, or the shape of your uterus is a problem, or we think there's something obstructive within the uterus, you can do a scope into the womb, or you can do a scope into the actual abdomen and actually look out for things like, is the uterus normal shape? It'll tell me about it. It'll tell me about your tubes. You can not just look and see, you can also treat, If you think tubes are looking obstructed, can they actually help be fixed? If there's lots of adhesions or scar tissues, if there are growths, can they be removed? Things like that. So those are the kind of minor and major tests that can happen from the woman's point of view as well. From the men's point of view, those blood tests as well, and that I'd mentioned some of them, but where men are concerned, often a semen sample, a semen analysis, where they would collect a sample with a certain criteria being reached, collect the sample, get it to the lab fast, analyze it, and see whether or not you have a problem that could be fixed as you'd asked before, or something that we believe would just worsen or not be able to be mended.
Okay. So this is a problem, infertility. What are the options when one does discover that you are infertile?
Well, depending on either treating the condition just as basics, and if that doesn't work, if the advice, the multivitamins, the treatment that you're trying to do to get the patient, the woman, to ovulate, to have a regular cycle, if those don't work, you get to what we call your assisted reproduction technologies. So your assistance with trying to fall pregnant. And that spectrum can go also minor and major.
I have no idea.
Absolutely. And most people sometimes think that the minute you mention I'm struggling to fall pregnant, they believe that we have to mortgage the house and sell the car and automatically, it doesn't necessarily have to be all of those. And if we really go along the avenues, it can be something as simple as a fertility drug and timed intercourse. That it can be a little more complicated, fertility drugs, and actually talking about actually doing artificial insemination with husband's sperm. And then you get to the real technologies where assisted reproduction is concerned, your kind of in vitro fertilization or other fertilizations, which basically involves, there are different tiers and categories that can be discussed, but it basically involves harvesting an egg, having your sterile washed sperm, and actually in some way or another getting the two together outside of the body, as in vitro, in a lab, and getting them back into the body afterwards, once you've proven that they can actually fertilize. And those are your assisted reproductive technologies that would happen.
And in that case, the last one that you mentioned, is that where you have to mortgage the body and sell the car?
Those are the ones that are definitely, cost-wise, can be an issue.
So talk to us about what are the costs involved, do medical aids, help with them, what are the hospital charges, the doctors, what are we looking at?
Often there are, as a general gynecologist, you can aid the patient to a certain point, and then it would be referred to one of my fertility colleagues. And I can't speak for all medical schemes, but what we've usually found in my experience is assisted reproduction and fertility does not get covered when we're dealing with the actual kind of in vitro fertilization or ICSIs or things like that, that the medical aids often do not cover where that's concerned. And this is where the costs become, to the patient where that's concerned. Often your investigations and things and your scopes and things like that with regard to the hospital, and that which is also just for general good health as well, those might be covered by your medical schemes and things. But when you actually start talking about the nitty-gritty, about the actual processes of falling pregnant, those are ones where you would need and your costs come in because you need a fertility lab, which is run with a vast number of people, including your technicians, your doctors, your fertility specialists, your embryologists, and your expensive equipment as well. So that's where the costs would really start racking up. And the problem sometimes is it may not happen with the first cycle. So you often may not, if you're very lucky it is, but it may not happen with that initial first cycle.
Okay, and once that process is going, the emotions involved. I know it's also a roller coaster, and I wanted to also talk about that. But coming back to the age and being infertile and using the options, fertility drugs and fertility treatment. Does age play a role on fertility treatment?
Absolutely,
as well?
absolutely. And especially what we'd mentioned earlier is that there is a cutoff. Sometimes there's a cutoff that we can determine through blood tests, and there's a cutoff that we can determine through age, where it makes assisted fertility treatment really difficult, and that they might turn you away at the door. I mean, I can't speak for some of the clinics and that, but a lot of the clinics would have age discrepancies that they would say, like above your 41s, 42s, things like that. But not just as blanket as that, based on also other tests to determine your fertility and determine your chances of that. For example, we have a test that can be done, that shouldn't be abused, but can be done, for example, on the second day or third day of your menstrual cycle. So on the second or third day of your bleed, there are a couple of tests that can be done that can give us predictions. And even though, yes, everything is in the hands of Allah, inshallah, there are certain tests and numbers where the clinics would say to you, we're really going to struggle. This may work or this may not work. So it can be as predictive and distinct as that.
Wow. When would you suggest those sort of tests? In what case?
Often if age plays a factor, and often if you're dealing with your late 30s or anywhere close to early 40s, where this is quite relevant.
Okay. Now, this, of course, has to happen when falling pregnant, and it's what happens behind closed doors. And we have to talk about, what happens there in the comfort as well as, both being comfortable. So how important is it to have that healthy, loving and mutually benefiting sexual life?
I think it's absolutely vital. For a couple of reasons, not just because obviously it is going to be important for falling pregnant, and not just because frequency equals efficacy sometimes, and that the fertility clinics might advise you that if you have no idea when your fertile time is, if you are having intercourse or sex or 3 to 4 times a week, you're bound to get to the right numbers and the fertile time. So other than just that, I think it is, there's a lot of sexual health problems that women do not even bring to our consultation. That women are too shy to bring, where your actual sexual health is not optimum. And there is pain, or there are problems, there are emotional problems or major anxiety, and those problems, I think, obviously can be a huge obstacle and a barrier to falling pregnant. So that's one. I do think that it needs to be, as fairy tale as it sounds, I do think it needs to be a comfortable relationship with mutual respect and a comfortable relationship, so that absolutely, because if we do end up having to go through anything where fertility or infertility starts being mentioned, it's a huge strain on a marriage.
Absolutely. So shukran so much for that. We'll look at more on infertility, on pregnancy and parenting after this. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. This is Pregnancy to Parenting. Just before the break, we spoke about infertility, fertility options, and the cost involved. And I want to go back to that just a little bit before we continue with the background of the couple as well. Assalamu alaikum and welcome back, Malika. Dr. Malika van der Schijf, obstetrician and gynecologist. We spoke earlier on about the fertility and the cost, and how the medical aids do, only pay a certain portion.
Yes.
And something that I've missed there was fertility drugs. Do they cover fertility drugs?
To my knowledge, I think not.
Okay.
There are different criteria for different medical schemes, but often, we would find that the patient would have to foot those bills out of pocket.
As well.
Yeah,
Okay.
absolutely. And I mean, there are different various grades of fertility drugs. And what I want to just say around this is, I always, and because people have that preconception that the minute they take that step to a fertility clinic or to a fertility specialist, that is it. Here goes the money and all of this and that. I would like to advise people out there, and other than it being an emotional step that you have to take, I'd like to advise couples out there also, nobody is doing IVF in the rooms immediately.
Okay.
Go for the consultation. Go and listen to what your options are. Go and listen to what your percentages are. Go and listen to how much time you might have. Go listen to what your costs are. And do not hesitate to say, we are not actually financially able at this point to do this. How much time do you think we have? Can we postpone this for 6 months? Can we postpone it for a couple of months? And they may say to you, no, I think, timing is of the essence now, or we'll do only this part of it and postpone a different part of it for later. So don't just automatically assume, that it's going to be absolutely negative about that or absolutely not going to fit into your life. Go find out. Tell your specialist what your constraints are and, what your issues and your limitations are, and see how that fits in with your fertility treatment or proposed fertility treatment.
That's a good one.
Absolutely.
I missed that one, to actually double check of what to ask when you're going to see if it's, and what are the what can you expect on your first consultation.
Absolutely.
So that is absolutely,
because it's bad enough, women out there just coming to a gynecologist, the preconceived ideas, the stress around that is just hectic. So add to that fertility specialists as well.
And I wonder, inshallah, we'll get to that point of seeing your gynecologist for the first time as well. And inshallah, we'll hopefully get some footage of a couple sitting in your rooms, so to give people an idea of what that's like. So the couple has investigated all the options of infertility, options that are available, the cost involved. And if all of that has come to an end and there is still nothing, there's years and years of trying and struggling and procedures and tests, what are the other options for couples after that?
There are limitations, obviously, where the fertility clinic will say to you, this is the only way it's going to happen, or this is not happening. And that would either fit in with you or with your principles or not. And I think often, and they don't jump at this lightly, you're then left with something like acceptance or adoption. Knowing that those are options as well that can happen if you're hoping to increase your family and have that baby.
It's accepting it, making dua that Allah puts that acceptance in your heart and contentment, and then there's the option of adoption as well.
Absolutely.
Now, we are looking at coming to the end of the show, and I want to try and recap everything that we have grasped here. Any sort of information that we might have missed with regards to fertility, the procedures, the problems, the things to watch out for, what we need to know, the must knows and the must not to knows. The emotional roller coaster when it comes to trying to fall pregnant.
Absolutely.
You mentioned the anxiety, because it is an anxious time, a couple being together for the first time. This relationship is building, and Islam, there is no dating. That's the first time you are together, and together behind closed doors. So that bond is quite close and intimate. So that first moment as well, and the anxieties around that. So that emotional roller coaster at the beginning, and then when you're married, the first question people ask is, so when is starting?
Absolutely. When is the baby coming?
So then you're trying, and that is also at the back of your mind. So that anxiety as well, and how that plays a role on trying to fall pregnant.
Yes, and absolutely background and genetics and things, as you'd mentioned before, parents and how fast they'd fallen pregnant. I think my biggest advice, which is often advice that works for most medical conditions, is do not hesitate to go and seek help. And not even just help, to go and seek advice. I can't tell you how many times it's just about what we call procreative advice that I'm giving, which for me might sound matter-of-factly, but to you, the patient, it's kind of, oh, I didn't realize that. I wasn't monitoring my cycle, or even worse, you have gone on the internet and you have gotten yourself in an absolute tiz. Absolutely. As I said, Dr. Google and Midwife Wiki, they just, it gets you in a complete tiz, and you've gotten things completely confused, or you're not even doing your ovulation tests correctly. So I think if I were to start right at the beginning, my advice would be, other than obviously choosing your relationships well, being comfortable with each other, if there are any sexual health issues, do not just leave it in that closed bedroom door and not discuss it with anyone. Discuss it with your elders if needs be. Come discuss it with us if you need be, because, we sometimes have problems where it has been that hectic or that painful to actually do something as simple as consummate the relationship or continue your sexual relationship. And you might need guidance, you might need advice, it might be a medical problem. And people are petrified to come and sit in front of a gynecologist and tell us those issues. And I think, I admire the people who make the effort and get to the rooms and get into, get on the chairs and get into the room to be able to say something. So that is important. Look at what your goals are. Have good health, your multivitamins, your high-dose multivitamins, your reckless behaviors like you're smoking and things like that. Stop those. Treat anything that you might suspect would be infections, sexually transmitted infections or pelvic infections. Treat them early, diagnose them early, because those tubes are so fragile. Keep an eye on your menstrual cycle. Do not hesitate to get it treated. And this applies not just to you, the wife, it applies to you, the mother who has a child, an older daughter or a woman who are not pregnant yet. If you have gynecological or medical issues, have them sorted. They could impact on your fertility. Or from the male point of view, if there's something you've noticed, if there's lumps or bumps that you're feeling, get them checked. So I think it's more prevention that I'm saying I think is vital and important. It is, do not play around with age. A lot of women when they come to the rooms, they want to be pregnant yesterday already, and it does take some time. If you are not lucky enough to be in the private sector, the public sector has a lot of time constraints because of their limitations in numbers. So go early. Don't wait to be age 41. The idea is, the textbook definition is a year. So I would say, keep that. That in mind. If you have struggled and you're not falling pregnant after a year for the most, please go and check that out.
Shukran so much. Now, after that concluding comments, I have so many questions, and hopefully we can deal with it in another show, inshallah. Please follow us on Facebook and like our page and ask your questions. And Dr. Malika van der Skeef will be back with us next time. Shukran so much, Dr. Malika.
Always
and we'll chat a little bit more about fertility and maybe, the parents' relationship with the couple as well.
Absolutely.
And looking at the first trimester as well.
Looking forward to it. Shukran and assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh to Dr. Malika. A big shukran to her, obstetrician gynecologist based out in Constantiaberg and here at the rooms in the Rondebosch Medical Center. I'm Hawa Solomon. Join me next time on Pregnancy to Parenting, where we look at the first trimester of falling pregnant. Assalamu alaikum wa rahmatullahi wa barakatuh.